very important, and I'll explain why. I have no disclosures to report. So here are some objectives for this talk. First, I want to help you understand the urgency behind why we need this evolved healthcare approach for pediatrics. I want to explain some domains of child health so that we can understand pediatrics, and explain the components of the preventive health visit. I'm going to describe some applications to horticultural therapy, to child health, and the preventive health visit, and then we can talk about some next steps. So as Kelly mentioned, this is the first webinar as part of the Growing Impact campaign. I think Kelly, I don't remember when Kelly started talking about this. It might have been over a year ago now. The goal of this campaign has just been to raise awareness of horticulture for youth, go to increase our partnerships with local companies, demonstrate the standards of HTA through programming, and then just grow the membership base. And so I'm really honored to be able to present this webinar as part of this campaign. A little bit about me. My wife is Jen. She's in that first picture. And part of why I feel so strongly that we need to improve pediatrics is because we will hopefully have a family soon, and we're bringing the next generation into this world, and we want to make it a better place. I'm an American, and I feel very strongly that being an American means constantly working on trying to improve America. And so I'm happy and hopeful that I can help do that. I love gardening. As was mentioned, I'm a resident physician right now. I've been a member of AHTA for about 4 or 5 years now. I've published articles in the AHTA magazine as well as scientific articles, and have presented at a number of places. And so I feel to a degree well qualified to talk about this at this point. And this year will be my 10th year living with type 1 diabetes. And so anytime someone lives with a chronic illness, I think they're always thinking about how can the system be made better. And in my case, I'm always thinking about how grateful I am for the system that we also have. So I just wanted to show a few things that I've written just to provide some more credibility. I wrote about how we can use digital tools to connect with nature. I've written about how we can incorporate horticultural therapy into hospital settings, especially how we can use the definition of high value care as quality of care divided by cost, and how I believe horticulture benefits all components of the healthcare setting. I've written about pediatric weight management in the garden, and got to speak with the team from Duke about what they're doing to bring gardening into their obesity clinic. I've gone to write about leadership approaches to HT programming, and then this is my first article that I got to write about economic opportunity that horticulture provides. So generally for this talk, I'm going to describe why the urgency. I want to help define what is child health, what horticulture can offer, and then ask the question, can we integrate horticulture into pediatrics? And then I'll summarize. So first, why the urgency? I truly believe that taking care of children is very similar to taking care of a seedling. And we really just do the best we can to help the seedling become its potential. And I think this graphic kind of represents to me that seedlings, when they're young and when they're developing, are very fragile. And so this leads me to want to think about some big trends that are impacting youth. I have some listed here. This is a very subjective, partial list based on my own observations. But I think it needs to be said that there are a lot of constructive, positive trends that are happening, as well as some concerning trends that we have to be aware of and address. And I could talk about all of these for a long period of time, but I just want to highlight a few things. First, on the constructive side, I think we can't take for granted how many people have access to constitutional rights today that has ever happened in human history. When we think about the Constitution as it was written in 1789, it was not for everybody. And over time in America, more people, regardless of race, regardless of sex, regardless of disability, are able to have protection for their constitutional rights. And I don't think we can take that for granted. And I think it's an amazing thing that we are giving children a country where these rights are protected. Medical advances, I mean, as someone living with type 1 diabetes, where insulin was only discovered about 100 years ago, I would already be dead in a time before medical advances in insulin. I mean, today, the way that we treat diabetes is unbelievable. Um, in vitro fertilization is unbelievable. For a major illness called cystic fibrosis that typically shortened people's lives until to their 20s or 30s, there are new medications out there that treat the underlying genetic problem associated with their condition. And this has only been done in practice over the last 5 years, but I've seen in the hospital, and everyone talks about how many fewer patients with CF we see in the hospital. And the only patients with CF who we tend to see in the hospital are ones who aren't able to take their medication or ones who have mutations that are not yet addressed by these CFTR medications. So there are probably thousands of examples of medical advances that we should be very proud of, and that tell us that the trend of health for youth is really positive. And then last, I would just want to draw on holistic approaches to health. I think this graphic just describes something called an optimal healing environment. It's a philosophical way of approaching medicine as trying to surround our patients with elements that facilitate healing. This is stuff that we got taught in medical school, and my suspicion is this is a new way of thinking about health that's going to have a really positive impact on young people. And then lastly, my university, which I'm very proud of, was the first nation to have an academic department of integrative medicine. They did this about 6 years ago, and it was a huge deal to lend credibility to the burgeoning field of integrative medicine, which is seeking to use whatever complementary, alternative, evidence-based, safe treatment modality that can be used to help our patients. But then I can always go on to the concerning side, and I've listed at least 15 things that are concerning trends that we'll be addressing and that will be facing youth. Overweight and obesity is a big thing that I think about. The prevalence of obesity has quadrupled since the 1960s, and a major clinical practice guideline was published in 2023. And in this article, they made a sentence that I thought was very telling. It said, a predictive model estimates that if 2017 obesity trends hold, 57% of children today, aged 2 to 19, will have obesity by the time they're 35 years of age. So 57% of children today having obesity by the time they're 35 years. I think that's very scary. There are many complications that come from obesity, and it shortens lives and takes away quality of life. And it's something that we have to address. A huge concerning and positive thing is the digital revolution that's here. This has been exacerbated by the COVID pandemic. This study that was published a few years ago was looking at screen use during the early stage of the pandemic, and it was a survey of about over 5,000 12-year-olds across the country, and it was showing that average screen time for these 12-year-olds was about 8 hours per day. You can see that there's differences by race and ethnicity, with Asian having 6.6 hours per day and Black having 10 hours per day of screen time. There were income disparities and parental education disparities. As has been talked about, this book was published in 2005 called Last Child in the Woods, that describes how children are spending fewer and fewer of their daylight hours out in nature. And this book describes why this has happened. Urbanization is a big part of it. And it paints a picture of a future where fewer and fewer children have a deep personal connection with nature. There's a clinic actually at Boston Children's Hospital that's specifically designed to help patients who have dysfunction in their lives related to their screen use. Dr. Michael Rich is a pediatrician who's really spearheaded this. He helped to define this term problematic interactive media use, which is 4 things. It's information seeking, pornography, social media, or video gaming, where you're doing these things to such an excess that it's leading to dysfunction in your life. And my suspicion is we're going to see more of this. And his clinic will be replicated in other places. And then we're having a massive digital revolution in terms of the economy. Many describe what we're in right now as the fourth industrial revolution, where AI will play a huge role in the economy. Jobs will be affected. There's always estimates between 40 and 60% of jobs today will be affected over the next 10 years with the AI revolution. And humans will be converging with technology in ways that are more immersive than have ever been done before. Um, these two books, I think, are very powerful for explaining where we're going. The Inevitable, which looks at 12 technological forces that shape the future. And then Ray Kurzweil wrote a book this year called The Singularity is Near, which suggests that we will merge with AI as a human species in the 2020s. And then last thing is we often talk about in medicine is that healthcare costs to the individual and system are always rising. Healthcare expenditures today are about 20% of our GDP, whereas we're seeing drops in birth rate relative to other industrialized countries. And it's something that we have to always be thinking about is how can we reduce healthcare costs? How can we increase the quality of care? And so all of these kind of lead to the big question of these are huge trends. And do we have to change what we're doing with how we're taking care of children, or can we continue to do it the same way we've been doing it? My suspicion is we do have to change, and we have to incorporate horticulture into that change. So before I talk about that, I do feel I have to define what is child health so that we all understand what we're talking about. In the early 2000s, the US Congress created a study panel. The goal of this panel was to better define how we think about child health so that we can monitor it better. And they defined child health as a child's ability to develop and realize their potential, satisfy their needs, develop the capacity to interact successfully with their environments. And this study also defined 3 domains of child health that we can think of as kind of buckets that make up the whole of a child's health experience. And so these 3 things are the individual's day-to-day health function, their conditions that they have or that we're screening for or that we're managing, and then always thinking about the child's potential and their developmental trajectory. And so these 3 things I'm going to talk about a little bit more so that we can understand examples. So first, thinking about the domains of child health is health function day to day. So simply, that's just what is the manifestation of that child's health on their daily life. A very commonly used assessment tool to understand day-to-day health function is the World Health Organization Quality of Life Assessment. I've listed it here. It describes 6 domains of health function: physical, psychological, level of independence, social relationships, environment, meaning the individual's relationship with their environment, and then the last domain is the individual's personal beliefs or spirituality. And so I think thinking about these different domains of health function help us understand what we can do to maximize these domains. How can we maximize an individual's pain, or minimize, I should say, their pain, maximize their energy and fatigue? How can we maximize their level of independence? How can we minimize body image challenges? How can we maximize their social relationships? And I just want to put another example of a scale that's used to understand level of function. This is more of a pediatric specific scale. It's called the functional status scale. And it's used to understand how children, how we can monitor their function while they're hospitalized. So this is looking at things like mental status. So does the child have normal sleep-wake periods, or are they unresponsive? This is looking at things like motor function. So do they have coordinated body movements, or do they have diffuse spasticity or paralysis? So next, after health function day to day, we think about what are the individual's health conditions. So I typically think about it, and classically what I read about is that we think about it from an acute to a chronic level. Acute health condition, something like pneumonia, for example, is a self-limited episode. As you get through the health experience, as you get through that episode, there are no long-term consequences. And then we think about chronic health conditions. So those are usually greater than a year. And as defined by the study that I was alluding to that the US government started in the early 2000s, Chronic is defined as increased utilization of healthcare, dependence on assistance. So that could be pharmacologic assistance like medications, that could be technology. I have an insulin pump and a CGM, so that's dependence on assistance, or functional limitation. And the reason I bring up these health conditions is because I think it's helpful to understand the common health conditions that kids in the United States face. This is a chart from 2010. I'm sure the prevalences have changed in the last 15 years, but I imagine the ranking is generally the same. So at the very top, we see overweight and obesity is the most prevalent, risk of developmental delay, environmental allergies, and learning disability and asthma. And then the last domain of child health is health potential. So that's just thinking about what are their assets, what are their positive aspects of health, such as resilience, competence, and their developmental potential. There are many ways to approach understanding this. This is a developmental philosophy, and there are three approaches that I'm going to talk about in this webinar. First is social ecological theory. So this is a developmental theory that looks at how does an individual reach their potential, and it suggests that an individual reaches their potential as a function of how they interact with all of the many convergent systems that are acting around them. So if the individual has their own health challenges, they're also interacting with the microsystem around them, which is their family, the health services, the local religious group, their neighborhood play area. So the microsystem defines the daily interactions with the infrastructure around them. And then you have a mesosystem, which defines interactions between the systems around somebody. Then you have the exosystem, which is like the larger community around the individual. And then you have a macro system, which is the culture of that, in which that person lives. And then lastly, I think about this as like stalactites, where things are moving outward. There's the chronosystem, which is looking at how all of these systems have changed over the course of time. And what is impacting the individual right now is just a cross section of the things that are happening right now in time. Recently, there was a pretty interesting article written that was looking at this social ecological theory and said that the microsystem has to be split into two completely different systems, the physical and the virtual. So again, if the microsystem is the direct infrastructure you're touching, your family, the grocery store, your peers, the neighborhood, what this article written in 2022 suggests is that there's a physical version of that and a virtual. So the things I'm physically interacting with would be a microsystem, and the things I'm virtually interacting with would be a separate microsystem. So we have to think about those two different systems. The second theoretical approach to thinking about health potential is something called the Positive Youth Development Framework. This was also an effort that was put on by the US government starting in the 1990s. And the core question was, how can we systematize across our different federal agencies a way of defining programs that best promote health? And it was done by a massive interagency working group. And basically, they broke down positive youth development into 4 domains. They said in order to produce healthy, productive, and engaged youth, we want to surround them with an enabling environment. We want to give them agency, so opportunity to prove themselves, to show themselves what they're capable of, to develop perseverance. Third is we want to give them assets. So this is training, literacy, education, social skills. And then we need to give them opportunities to contribute and lead. And if given all of these things, then we're giving the individual the best chance of becoming a healthy and productive adult. And then the last approach that I think about is very fascinating. I read in this book, Wildhood, which was written by a physician and a developmental biologist a few years ago. And this book basically asked the question, well, it's basically a book of observations across species that suggests that there are 4 tests of adolescence that are consistent across species, that in order to be an adult, you have to pass through those 4 tests of adolescence. And those four tests are: how do you be safe from threat? How do you socialize? Do you connect romantically? And can you live independently? And I would argue that living independently is a function of your health conditions and is a function of your day-to-day health. Individuals who have technology dependence might have a different level of independence than someone who has no technology dependence. So when I think about living independently, I think of living independently to the maximum of your ability. So to me, I think it's important to talk about these domains because our goal is to optimize all three. That's what we should be thinking about in our evolved healthcare approach for pediatrics. How do we optimize the individual's day-to-day function? How do we optimize how we're screening for, how we're treating health conditions? And then how do we always maximize our patient's health potential? So when thinking about that, I think it's valuable to think about how do pediatricians approach preventive care. Bright Futures is a publication of the American Academy of Pediatrics. And I was given a Bright Futures book on my first day of residency, and it's really the holy grail of how we approach preventive health visits. So these are visits that are not sick visits or emergency visits. These are health supervision visits. Within this publication, there's a chart with all of the well child visits that would be expected for a child who does not have extra healthcare needs. And so this chart goes through in infancy, so that's prenatal, newborn, all the way up to 9 months old, and then early childhood, which is 1 year to 4 years, middle childhood, which is 5 years to 10 years, and then adolescence, which is 11 years all the way up to adulthood, which this chart defines at 21 years old, but I know in our clinic we see patients who are up to 25 years old. Next, what this chart shows is the history. So these are components of the preventive pediatric health visit. So you gather a history. Has the patient been to the emergency department or urgent care recently? How are they doing? How are they eating, peeing, pooping? We take measurements at all these visits. So we look at their length, their weight, head circumference. We start calculating BMI, and we measure blood pressure. We do vision and hearing screenings. We do developmental screenings, social screenings, behavioral screenings, and mental health screenings, as well as substance use. We'll do a complete physical examination, and then we'll do a variety of procedures. So this ranges from immunizations all the way to lead testing to sexually transmitted infection testing. And then we do oral health supervision. So this is applying fluoride or supplementing with fluoride to prevent against cavities. And this is also making sure that the patient has dental care. And then last is we finish with anticipatory guidance with every visit. So I bring up this chart because I think it's valuable to apply these concepts to some patients, and we can then understand how horticulture could fit into medicine. I don't have a great way of presenting this information, so please give me grace that I'm just using a table. But our first patient, you walk in, and it is an absolutely adorable 4-month-old female. She has no chronic health conditions. She has not been to the emergency department or urgent care. She's peeing, pooping, eating, sleeping, doing all the things really well. She has normal height, weight, length. Everything's looking good. Her vision and hearing screen was normal. But when you do the depression screen, you see that maternal depression was screened positive. And you ask mom a little bit more about that. And it sounds like since baby was born, mom has not been socializing that much and has lost interest in doing things. Also, this baby's 4 months old. At 4 months, if they're meeting their developmental milestones, such as being able to lift their head, starting to bring food to their face, starting to move their hands to their face, at this point, then we can say that we're comfortable with the baby transitioning to solid foods. So you bring this up with mom, but mom's really concerned about the cost. Physical exam is totally normal. The baby gets their 4-month vaccines and their oral health looks good. Next, you have a 3-year-old male. He has autism spectrum disorder, but he's very well connected to services. He hasn't been to the emergency department or urgent care recently. He's peeing, pooping, eating, sleeping, doing all the things well. But you notice when you took a look at his measurements that his BMI is in the 99th percentile, which puts him in an obesity category. Otherwise, his blood pressure and his height are normal. His vision and hearing are normal. Developmentally, you know from his 30-month autism screen that he's screened positive, and he's been connected to services, but the other screens are all normal. The exam is a normal exam with the child bounding around the room. No vaccines are due at this visit, and their oral health is normal. Next, we have a 9-year-old male. He has type 1 diabetes for the last 8 years since he was 1, and he's been hospitalized multiple times because of it. He's excessively on his phone and is having behavioral outbursts when we ask him to put it away. He does not like to eat very often, but otherwise he's peeing and pooping, sleeping, doing all the things normally. His BMI is in the second percentile, but you look at the growth chart and he's always been kind of small, but he has normal height and blood pressure. His vision and hearing are normal. Developmentally, what he fills out is nothing notable. And then the physical exam is he's just an agitated kid. He's wearing his diabetes supplies. He has skin changes and bruising on his abdomen. When you ask him about mental health, he doesn't want to talk to you. Procedures, he has no vaccines due at this visit, and his oral health is normal. And then lastly, you have a 19-year-old female. She has no medical history. She's a new patient. She's in college for psychology, but she's unsure of what she wants to do with her career. She's worried about her future economically. She's had a lot of recent emergency department visits. It seems like she gets her primary care out of the emergency department. She has a normal appetite, and she's peeing, pooping, sleeping appropriately. Her measurements are normal. You know that she has poor vision, but has never received vision care. The anxiety screen indicates a high chance of an anxiety disorder, but she has no depression or safety risks. She vapes e-cigarettes, but no other substance use, and she's sexually active. Physical exam, she's not very interactive, but otherwise it's normal. We do a lot of lab testing and start her on getting some vaccines. And then for oral health, she says she has not seen a dentist in years. So none of these patients are real people. They're just made up from what I've seen of patients at these ages. But I think they give you a window into some things that we really commonly see in primary care pediatrics. And so the question becomes, why am I telling you about this? And why am I introducing these patients to you? And that's because I think this illustrates how horticulture can have a positive impact on all aspects of child health. And I want to explore how horticulture can actually be integrated into pediatrics. So this is one where, Kelly, I'm going to need your help for this slide.
Okay.
I am going to read some assessments about what we think about each of these patients, and I want people to put in the chat if they can think of ways that a horticultural therapist could help this patient. So Kelly, I think if you read the chat, or I think I'd be able to do it, or maybe it will be in the Q&A.
Okay.
So the first one is the 4-month-old female. She's doing really well, but you note that her mom has food insecurity and depression. You have a 3-year-old male with autism who's very well connected and is doing well, but he has elevated BMI that you need to address. You have a 9-year-old male with poorly controlled type 1 diabetes, and it seems like he's having lots of outbursts, probably due to problematic screen use, and he has generally a low appetite. And then lastly, you have a 19-year-old female who really needs her care to be coordinated, has lots of healthcare needs, and has lots of concerns about her vocational future. So the question then becomes, what could we be offering? What could horticulture offer these people? So Kelly, I don't know if there's any chats. People just want to throw.
Okay, nothing in the chat yet.
I will keep moving just for the sake of time, but as people are thinking about it, just think of ways that a horticultural therapist could help any of these people.
The chat is disabled, so let's put it in the Q&A.
So I'm going to proceed, but Kelly, if you see something interesting.
Type your answer, those. Yeah.
Okay, so then thinking about what a horticultural therapist could offer, I just wanted to put in this chart or in this presentation, um, when I'm seeing a patient and I'm ready to make a referral where I'm going to refer to a specialist, at our clinic, this is what our referral Epic site looks like, our electronic health record. You can see that there's referrals for food pharmacy, for genetics, for mother and child mental health. And then there's lots of referrals for specialists like pediatric endocrinology, pediatric nephrology. One thing you don't see on here, though, is a referral to a horticultural therapist.
Okay, so people are starting to put responses in. For the 19-year-old, it is suggested a vocational HT program. And then someone else also said the adolescent can use vocational skills for HT that could hopefully encourage them to try horticulture.
Perfect. These are such great answers. Perfect. And then I see the infant maybe suggest a mother and Bubs group, which is lovely. Perfect. So I'll just go right through it then. So for the infant, definitely. I'm imagining you have a registered horticultural therapist who's practicing privately. They partnered with their local Parks and Recreation department, and they lead twice weekly garden nutrition sessions for new parents. So this is a double whammy. This is connecting the mom to food, connecting the mom to social, and teaching her about nutrition. For the 3-year-old, um, I'm imagining the horticultural therapist is hired by a clinic to build and manage a large vegetable greenhouse on site. I'm imagining they co-lead an intensive obesity treatment program, which is the gold standard across the country. And this ensures that patients have at least 26 hours of face-to-face treatment, which is the gold standard for stabilizing a BMI trajectory. For their 9-year-old with poorly controlled type 1 diabetes, I'm imagining a large health network where the horticultural therapist is embedded within the psychosocial services. So this patient needs psychotherapy, I believe. And I'm imagining that the horticultural therapist could be maintaining sites where some of this therapy can happen. I imagine the horticultural therapist also leads a youth teaching in the garden series for patients just like this who need divergence away from their screen. And then last, for the 19-year-old female, she has lots of healthcare needs and she has concerns about her future. I'm imagining the horticultural therapist is hired to build and manage a practice's local greenhouse. And they teach classes monthly on working on the horticultural industry. I'm also imagining that the horticultural therapist is part of that clinic's care coordination. So maybe the horticultural therapist sees patients who have been added to their care coordination list, and the horticultural therapist is reaching out, describing events that are coming up at the garden to keep this person coming back to the clinic to make sure that they're getting their health needs. So these are just a few examples, but these are ways that we could maximize health that we're not doing right now that horticultural therapists can offer. So just to kind of round out the talk, and I don't know who all the audience is, so I wanted to give a little bit more about horticulture. I want to talk about some evidence supporting it. This is partly why I explained the domains of child health so that we could come back to these definitions and look at them. So for health function day to day, just looking at studies, there was a study looking at a horticultural therapy program for pain management, and that it improved physical and mental health and coping ability with respect to chronic pain. There was a systemic review published looking at youth, and it showed that high screen time is associated with negative psychological outcomes, but that nature time can actually buffer these screen time related outcomes. There was a meta-analysis that showed that increased nature exposure decreases measure of stress, such as cortisol, states of anxiety, self-reported stress, blood pressure, and heart rate variability. And then another study looking at how participation in an 8-session HT program for vocational training of adults with intellectual disability showed that they developed improved fine motor control and interpersonal social skills. There are countless examples of how horticulture and horticultural therapy can be used in a variety of health conditions. So looking at overweight and obesity, systematic reviews and meta-analysis show that school gardening activities when combined with physical activity, can significantly increase the fruit and vegetable consumption among kids and has a modest impact on BMI. A study in secondary schools showed that school gardens are associated with lower BMI. Community gardening has been associated with lower BMI and reduced odds of being overweight. A randomized control trial, and this one was actually published just this year. A randomized control trial shows that intensive obesity treatment can be conducted as a partnership between an obesity clinic and a local parks and recreation department. Looking at allergies, so this study from 2015 showed that if you grew up with a green area within 3 miles of your home, you had a decreased risk of having environmental allergies. Asthma, kids who live in neighborhoods with more vegetation and street trees are less likely to develop asthma. There's been lots of research on ADHD, so children with ADHD who play in windowless settings had significantly more severe symptoms than those who play in grassy outdoor spaces. A systematic review found that nature exposure for kids is associated with reduced ADHD diagnoses and symptom severity. For lupus, a rheumatological condition, an autoimmune condition, in this 2008 study, they showed that childhood farm residence was associated with decreased odds of developing lupus. For type 1 diabetes, this study showed that living in an agricultural environment early in life was associated with a decreased risk of developing type 1 diabetes. And then lastly, looking at the 3 theories that look at health potential, I try to collapse them into ways that we could collect evidence for. So I found my collapse came to core features that help youth reach their potential include providing them with an active pro-social environment, providing them with opportunities for bonding, agency to create identity, opportunities to learn personal safety and life skills and assets, and then chances to give back and engage. And then there have been lots of studies that looked at these components as well. So this study from 2018, looking at safety, looked at how green schoolyards were associated with increased physical activity and pro-social behavior in an urban low-income neighborhood. Looking at critical thinking skills, this study of 9th and 12th graders showed that students performed better on critical thinking tests when they had participated in an environment-based education program versus a normal education program. And then long-term environmentalism. So this was a qualitative analysis that showed that adults who had had more early childhood exposure to nature developed higher environmentalism identity later on in their adult life, suggesting that nature can set a person on a life course trajectory toward adult environmentalism. So I hope that I've convinced you that there's evidence to suggest that horticulture interventions in nature can improve all of these domains of child health. So our goal is to optimize all 3, and I really think horticulture can do that. So for next is understanding kind of the theory behind how horticulture works. There's a lot of modern thinking and scientific explanations for what we see. But prior to modern thinking, I think it goes without saying that there have always been traditional ways that have connected us to nature. And there are these concepts of natural or first laws that view human and the ecosystem as deeply interconnected. And I include this. This is Chief Seall, who was a chief in the Pacific Northwest, born in the 1700s. He sold the land in the Pacific Northwest to the US federal government in the 1850s. And this is a letter that he writes to the president at the time, trying to explain his belief of a human's connection with nature. And he says, the president in Washington sends word that he wishes to buy our land. But how can you buy or sell the sky, the land? The idea is strange to us. If we do not own the freshness of the air and the sparkle of the water, how can you buy them? Every part of the earth is sacred to my people. Every shining pine needle, every sandy shore, every mist in the dark woods, every meadow, every humming insect, All are holy in the memory and experience of my people. If we sell you our land, remember that the air is precious to us, that the air shares its spirit with all the life that it supports. The wind that gave our grandfather his first breath also received his last sigh. The wind also gives our children the spirit of life. So if we sell our land, you must keep it apart and sacred, as a place where man can go to taste the wind that is sweetened by the meadow flowers. A very seminal way of thinking about how nature benefits humans goes back to E.O. Wilson, who is a biologist. He coined the term biophilia, which suggests that humans have an innate affinity for nature and that there's an evolutionary basis for our affinity for nature. One of the early researchers who showed that nature exposure can have positive clinical impacts was Roger Ehrlich. And he has kind of helped us understand the stress recovery improvements that natural environments have in the clinical setting and in urban environments. Then there's the Kaplan, Stephen Kaplan and Rachel Kaplan. They were psychologists who talked about the restorative benefits of nature and how they define a restorative environment as one that separates us from our thoughts and concerns, holds our attention effortlessly, immerses and engages us in a world with such richness that it constitutes another world and creates opportunities for joy. And anyone who's been in a garden or been around nature can relate that nature is a restorative environment. And they basically suggest that as we go through our day-to-day tasks, we fatigue our ability to have focused attention, and you need effortless attention in order to restore that energy. And that nature can provide that effortless attention. Another way of thinking about how nature has its benefits is the neurosequential model of therapeutics. So this suggests that there are different domains in the brain that have different functions, and that different gardening activities can regulate those parts of the brain. And in regulating and stimulating them, it makes for a more coordinated nervous system. So this would be something like the brainstem with our sensory and motor inputs and outputs. The way that we would consolidate that would be multi-sensory garden walks or weeding or watering versus our neocortex, which is our most cognitively high-level problem-solving part of our brain. The way that you stimulate that is with botany projects or project management or thinking about hydroponics. And then the last one I'll bring up is this was published about a decade ago, looking at how a central the central reason for the benefits of nature could be that it improves our immune function. That there are all of these physiologic and psychological states that are benefited from being in nature, and that it moves through an immune central pathway. So next, I think it goes without saying that horticultural therapy is run by a very well-regulated profession. I could go into the history of HTA. This magazine shows that it celebrated its 50th anniversary a few years ago. I think AHTA, it was started, I could go into the history of it, but it's a very well-regulated profession, and it provides the infrastructure for us to move horticultural therapy into the modern age. There are regional groups all over the country to help support people who are involved in horticultural therapy, and there's more groups that are growing seemingly every year. HTA does an annual scientific conference. This next one is in October, and HTA also sponsors a journal where scientific articles can be published. Next, there's many cost-saving benefits of horticulture. It goes without saying that healthcare is very expensive. Variable expenses in healthcare include burnout, employee turnover, patient length of stay, patient utilization, workplace productivity, absenteeism, medical error, and defensive medicine. But this article a few years ago, this was an economic white paper that was looking at a calculator that you could use to calculate the cost-saving benefits of adding green spaces to a hospital. And what they used as the inputs into the tool were they estimated excess costs resulting from burnout. So this is increased turnover, work effort reduction, and medical liability risk. They look at potential cost offsets of the nature-based intervention. They look at net benefit costs of the intervention, and then the net value in subsequent years. And so this was just looking at examples of how you could estimate the cost saving benefits for a small hospital of being about $1.6 million every year, and for a large hospital being about $13 million every year. And then last is that horticulture is already practiced in many, many clinical settings. This is just a few pictures. Rainbow Babies and Children's Hospital in Cleveland in the top left, Sydney Children's Hospital in Sydney, Australia, Stanford Children's Hospital, McGee Rehab. McGee has a horticultural therapist on site. Legacy Emmanuel Medical Center has horticultural therapy on site. And then the top picture is from Overbrook School for the Blind, which has a horticultural therapist on site and provides locations where lots of medical treatments can be provided. There are over 148 sites and activities across about 6,100 US hospitals. This article, Horticulture for Health, outlines what those horticulture activities look like. And then this website, Therapeutic Landscapes Network, just always updates its list on gardens and therapeutic horticulture sites in clinical environments. So the big question, so can we integrate horticulture into pediatrics? I think absolutely, certainly. Some things that we're going to have to do to get there is we're going to have to increase the awareness among people in primary care pediatrics. I did a survey study in Philadelphia where we sent a survey out to about 3,000 primary care pediatricians in Philadelphia. About 200 responded, and of the 200 who responded, less than 10% had ever heard of horticultural therapy. But once we gave a little definition, 70% said they would refer to a horticultural therapist if one was available. So we need to make them available, and we need to teach our partners about it. One great example of a nature prescription is Park RX, was co-founded by Robert Czar, who gave a talk at the AHTA conference a few years ago. And these are basically prescriptions that a primary care provider can give to a patient to instruct them on spending time in nature. One idea I bring up is that this is a commonly used nature relatedness scale. Maybe this type of scale can be used as a screener that we add to the primary care visit to try to get a sense for how the child thinks they are related to nature. And if patients screen very low, meaning they have a low relationship with nature, then we try to give them access to horticultural therapy. But in addition to thinking about primary care pediatrics, we have to think about all the specialists who are involved in primary or in pediatric care as well. I go back to this list of all of the referrals we can make. All of these entities might be interested in collaborating with you on a research project, on a trial project, on a garden project. And so you should be very creative reaching out to people locally in your environment. Next would be conceiving of new places that horticultural therapists can work in the healthcare ecosystem. Being creative and urgent about partnerships. So I just list a variety of local entities that you could partner with. These are organizations that support health conditions, local professional societies, training universities, medical offices, local gardens and arboretums, coordinating with adjunct therapies, nature centers. So really this is where our creativity is our main limiting factor. And even just focusing on one aspect, organizations that support health conditions, this is just a small list, but there are dozens or hundreds of organizations that support specific health conditions. And these all could be partners that you could partner with for a research project, or you could partner with for an actual clinical intervention. Next is identifying and addressing barriers to entry. I believe it's very important that the horticultural therapy community generates a standard economic assessment for the cost-saving benefits of incorporating registered horticultural therapists into healthcare spaces, and what plans of implementation can be created, because this type of economic pitch can be distributed to partners very easily. There has to be more randomized control trials of horticultural therapy interventions. Randomized control trials and then meta-analyses of these are kind of the gold standard in medicine for when we are going to incorporate a new treatment modality. So there just has to be more randomized control trials. We always have to improve HD programming and share ideas with each other. I think it's important to establish minimum standard wage and work conditions that could be standardized across the country. I think it might be considered that we should add nutritional training into the horticultural therapy training workflow. Horticultural therapists who can also teach about nutrition or offer nutrition support are going to be much more valuable. And it also is logical that if you are teaching about fresh fruits and vegetables, it would make sense that you could go that extra step of teaching about the nutrition. There's been an ongoing process to increase credentialing to board certification. Once that's done, this will make it more likely that horticultural therapy can be reimbursed by the Centers for Medicare and Medicaid. And so once that credentialing to board certification happens, there should be an aggressive push towards pursuing reimbursement. There's got to be more social media to grow the movement, expose more young people, expose more second, third, fourth career people, expose more retirees. More people should be aware about the movement. And then presenting research at not just horticultural therapy conferences, but nursing conferences and asthma, lung disease conferences, and presenting in these journals as well. And then just starting a local business and trying to find your community niche is going to be a great way to grow our base of horticultural therapists and grow the movement as well. So I think there's a number of places that could be potential pushbacks or hurdles. As I said, there's very few randomized control trials, and of the randomized control trials, very, very few are with children. There's not much standardization of HT interventions. There are patient safety concerns, medical legal concerns. There's concerns about lack of space or funding. And then the big one is there's probably right now not enough horticultural therapists to hire. So that's the big thing that we can work on is I believe we are in a movement, and I believe we're in a really important time where horticultural therapy can have a very big positive impact on the future of children. So this decade should be the decade where it happens. Right now, there's 250 horticultural therapists who are registered, and about 20 work in hospitals. If we really want to impact healthcare, I think 30,000 one decade from now. So just in conclusion, this picture is from the first horticultural therapy experience I ever witnessed. To conclude, I believe modern society is transforming rapidly and that we must evolve our healthcare approach for pediatrics. I hope I've shown that horticultural activities have the potential to support all domains of child health. Registered horticultural therapists are very well prepared to lead horticultural interventions in clinical settings, and partners and local communities will be the engine of that change. So just want to finish. This is the last slide. Please scan this if you have any feedback, or email me if you have any feedback. And I really, really appreciate you taking the time to talk. And I'm happy to take any questions now.
So please send the questions our way through the Q&A box. And while those questions are being put in, I'm curious, in your practice, where do you think the pediatric profession is in wanting horticultural therapy to be really integrated into that care plan? You mentioned not many were aware, but once they were aware of it, 70% said that they would be receptive to incorporating it. And I understand insurance reimbursement has to get involved, etc. But where do you think we are on that?
Whenever I talk about it with people, with colleagues, I get a sense that people are really excited and want to learn more. I don't think there are enough horticultural therapists right now to even offer something to my colleagues and say, here's someone who you could potentially partner with. I think one of the questions is thoughts on funding given the federal situation. My inclination is that horticultural therapists could actually reduce costs in the healthcare system. And that's the main goal of all of these healthcare companies. Um, and so I think in the absence of funding from the federal government, there can still be an argument to be made that this reduces costs long term and this increases patient satisfaction and outcomes long term. Uh,
Mhm.
so yeah, I mean, I think my colleagues are very interested in it. And as I mentioned with my research, less than 10% of people really have ever heard of this. Um,
Mhm.
but we're in a movement right now where there's more awareness of holistic approaches to health. So I think they are ripe for it right now.
And you're saying even incorporating more of a nutritional
Yeah.
expertise into the role of the horticultural therapist might be an extra avenue to pursue with that.
Totally. Yeah, totally. And I
Yeah.
think it would make it easier for a healthcare system or for a company to want to hire a horticultural therapist if they know that they can offer a service related to nutrition as well.
Okay. One attendee is saying, what are your thoughts on funding given the federal situation?
Yeah, I mean, I think big picture, I think horticulture saves costs. Um, I really believe that AHTA should hire at some point, hire some economists or accountants, people who can really show the cost saving benefits of a horticultural therapist. And then that could be like a white paper that's published to show the positive impact that horticultural therapists can have. Um, but my assumption is that healthcare funding is going to be very dynamic over the next 5 to 10 years. And healthcare companies will always be trying to reduce their costs. And that long term, I think this could reduce their costs.
Another attendee is saying HT needs to be integral to IEPs, IHPs,
Mm.
etc., and the treatment team. Thoughts on that?
Yeah, I mean, totally. Yeah, I mean, there's so much opportunity for so IEPs are the individualized education programs that get produced by a school, and there's so much opportunity for horticultural therapy in a school. Um, I yeah, that's the I mean, a horticultural therapy intervention could be a part of someone's IEP, could be a part of the therapeutic goals that they have. So yeah, I think that's definitely true.
Are hospitals in general open to past hurdles like concerns about soil and certain plants?
Hmm. It's funny. I did a rotation on pediatric infectious disease a few months ago, and one of the people I worked with, he's really interested in giving patients probiotics and prebiotics after they've had a big course of antibiotics to try to reconstitute their gut microbiome. And when I told him about horticultural therapy, the first thing he said was, "I wouldn't want soil near my patients." And so I do think that is a big safety concern, um, and one that can be addressed in a number of ways. I mean, you could design a garden, you could do water, you could do hydroponics, you could do soilless gardening, um, you could read about gardening. There's a lot of research right now looking at biophilic imagery using screens. That could be a whole avenue as well that a horticultural therapist could take. But yeah, I do think that soil contamination in soil is a concern. So we would have to adapt it to the patient.
Are you seeing more hydroponics being offered in these settings?
No,
Okay.
but it could.
Hmm.
But that was one way that I responded to that
Yeah,
attempt.
yeah, absolutely. We at Healing by Growing have patients using this service. How do we open this up to get more referrals for patients
Mm,
to benefit from our all free services to the patients?
mm. I think this question speaks to a core challenge that the horticultural therapy field has always faced, which is how do you get people to pay for this? Uh, and it's a very good question. My suspicion is that there's many, many different entities who could provide kind of like grants or um, large scale funding. There could be local organizations, there could be individual benefactors. Um, The company itself could create a discretionary fund, but I imagine that there would have to be funding set aside in order to open it up to more patients. And then there's always selling products. I don't know if anyone on this call or have an experience with that being a very good revenue stream. But that's always an option as well as to offset costs is to sell products from the horticultural therapy program.
Right. What are your thoughts on HT for medical staff burnout and stress management versus
Hmm.
patient care plans,
Oh,
retention rates, employee relations would all help with cost conversations?
oh yeah, totally. Yeah. I mean, the calculator that I mentioned, it basically used the cost associated with burnout to to describe the cost saving benefits of gardens. There was a study a few years ago that was showing that nurses who take a break in a garden show significantly improved levels of energy and less exhaustion. So that's I mean, that is a huge burgeoning field. And we know, I mean, one of the things that I listed but didn't talk about is that health worker burnout is a huge issue in medicine. And it was exacerbated by COVID. And it's a huge issue that's going to continue to be an issue, which is one of the reasons why I think horticulture can have so much benefit. I mean, I imagine walking into a hospital setting and the staff worker, the patient, the family member, all of these people can just be in the garden and they are not the nurse, they are not the parent, they're just a person in the garden. And I think that that would help offset some of the burnout that happens in medicine.
Is there any, have you seen any instances of even indoor gardens being offered in pediatric um, uh, offices to encourage that connection and then further grow that?
Hmm. I think what I see more of is people providing resources from their office on like local ways to get nature. There was a book that was published, I think, in this last year called Digging into Nature, which was published by two pediatricians out in Seattle. And the whole book just describes ways that you can incorporate nature into your life. Um, I'm sure if I asked more people, there would be examples of doctors' offices who give out kind of like mini experiences with nature. But I don't know. That's a great question.
Right. Right. And then very a highly engaging conversation here. Lots in the Q&A. Medical professionals need to understand that HTs are not just plant lovers or that anyone can garden. There are baselines, goals and objectives, and documentation.
Totally.
So
Yeah.
really that's getting into evidence-based practice.
Yeah. And I think one thing that horticultural therapists should also broadcast about themselves is that they can manage the natural ecosystem at that site. I mean, Teresa Hazen at like Legacy Health in Portland, the horticultural therapist service there helps to manage the nature ecosystem there. Rich Mateo, who's a horticultural therapist at Overbrook School for the Blind, he manages all of the various gardens around the school. And I think that's something that has to be broadcast, that the horticultural therapists themselves, it's not some free job that they're just a plant lover and they would do it for free as a volunteer. Like they're managing a whole ecosystem. I think that's one of the opportunities for horticultural therapy is managing those ecosystems. That's yeah. Um,
Right. And this leads into the next question. So one attendee is in the horticulture field and currently doing olericulture therapy for autistic kids. How do you become a registered horticultural therapist? What
mm,
coursework is involved? You're alluding to that already, where it really combines that psychology, human services with the horticulture.
Totally. Yeah. A few years ago at the HTA conference, there was a landscape engineer named Virginia Bird who gave a talk on how do you design a garden for adults with autism or special needs. And it was wonderful. I mean, that was a mind blowing talk where it very heavily leaned on um, working with the local community to get a sense for what they want. But the talk showed all these examples of young adults with special needs who had so much benefit from the garden, being in a perch above the garden and just being able to look, playing in the water, doing their vocational training in the garden. So yeah, there's so much that we can do for patients with autism or neurodivergence or special needs.
Right. And then last, will everyone attending this webinar receive the recording with the slides? So we will be posting the recording. Andy has also generously offered to provide some resources. The attendee is saying, I'm particularly interested in sharing some specific studies to
Mm,
convince people that evidence-based information is critical. And that's an excellent point. Yes, we at HTA are strongly evidence-based.
yeah, maybe we'll share that either tomorrow or early next week. We'll send that out.
Yeah, absolutely. And so hopefully that those resources can be put into program justifications or be made to enhance everyone's knowledge. And then we just go share that knowledge and move this youth campaign forward with all this momentum.
So,
So, are there any other questions you'd like to put in the chat? Anyone? I'll look right there. Okay, so I think we're about ready to wrap up. Thank you so much for this incredibly thoughtful and scientifically based presentation. And, you know, this is really going to move uh, youth wellness forward on so many aspects. I know there's a lot we have to do, and it's really sounding from your presentation you know, raising awareness and talking about it and really getting in there with that evidence-based research is one of the first critical steps that we need to do. And I also really appreciate your perspective on the, you know, adding the nutrition aspect because that really fits naturally with what horticultural therapists and individuals in therapeutic horticulture do as well. So, Dr. Zeiger is just one of the first. Thank you so much for starting off the youth campaign with this. Next week, Tuesday, April 1st, Dr. Charlie Hall. He is from Texas A&M University, professor in the Department of Horticultural Sciences and also Ellison Chair in International Floriculture. And he will be talking on the topic Nature Nurtures, how gardening and outdoor play support kids' mental and emotional well-being. And then on to round out the youth campaign wellness series, we will have Healing People Heal the Planet, Becoming Eco-Aware. And this is really a highly thought-provoking webinar that addresses concerns about the climate anxiety, climate crisis, and how we can move forward with that in terms of developing and enhancing our own dimensions of health and also becoming more ecologically attuned and really helping our youth to move into leadership with that. So Nellie Bisram, she is founder of AHEM Education and also a lead representative to the United Nations. She will be talking, as well as Piero Falci, who is highly engaged in mindfulness and mindful living. He teaches youth on that. He is the co-creator of Be Nature and the author of Mindfulness for a Better Mind, Life, and World. So we really are very pleased to be able to offer very well-rounded topics for this youth wellness webinar series. And all of this, we thank Ball Horticultural Company so much for being the sponsor for this webinar series and being able to offer all of this to you free. So hopefully we will enhance the knowledge base on youth wellness and then keep in touch. In phase 2 of the youth campaign, we will start applying all of this wonderful expertise into action. And we will start highlighting specific sites all across the country from our AHTA community who are really doing some incredibly impactful programs to help nurture youth and set them up for strong skill sets and joy and resilience in this ever-changing world. So we're really looking forward to that. And then phase 3 of the campaign will be in the fall. We call that Harvesting Growth, where we're really going to be looking at the results of this youth campaign and seeing what outcomes follow for the youth, and then wrap that up with the AHT annual conference in October, where we'll be reporting on a lot of what has happened with this campaign. The AHTA annual conference campaign will be virtual. So I encourage you to attend that. It is just another opportunity to continue all of this expertise and collaboration. And we at AHTA have found that when we can really connect with individuals in allied professions and within our AHT community, we really get a lot of things moving along that help the populations that we serve. So thank you very much for all of that. And again, a big thank you to Ball Horticultural Company for bringing this to us. All right.